Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
We are going to study about the stomach. So as you know, the stomach is the part of alimentary canal between your esophagus and small intestine. It is situated, and it is a muscular sac. It is a jet-shaped one. So this is the picture of stomach. So this is the top opening. This is the esophageal sphincter, esophageal opening. This is the esophagus. Esophagus opens into the stomach. So this is actually the cardiac orifice, and here you can see another sphincter, that is pyloric sphincter. So this is the lower part of the stomach, and after that duodenum. Okay. Then where it is situated in your abdomen, that is in the left quadrant, left upper quadrant, epigastric and umbilical region, and most of the parts of the stomach will cover the under cover of the ribs, and stomach located at the vertebra level T10, T11, T12, L1, L2, L3. So this much vertebra level, this organ is extended, and according to our position of the body, it will be varying. The size of the stomach, the position of the stomach will be varying. And stomach we can classify it into three parts. That is fundus, which is just above the cardiac orifice. So just above is the fundus, just below is the body, and after that is the antrum, and this is a pylorus, then is the duodenum. Then two curvature, lesser curvature and the greater curvature. Okay. And here you can see this portion is the cardia. This is the lesser curvature. This one is the angular incisori. So this is an imaginary line. So the stomach is divided into main reservoir part and the pyloric part, cardiac part and the pyloric part. Within this again divided into body and the fundus. Okay. Then about the surfaces. So there are two surfaces. So that is antero-superior surface and postero-inferior surface. Opening, I told you there are two openings. One is from the esophagus and another is from the pylorus to duodenum. So this is the gastroesophageal opening, and this is the pyloric opening to the duodenum. And the sphincters, there are two sphincter. So sphincter means, you know, some muscle action will be there, muscle will be there, and it will be closest the top end of the stomach. Which one? The cardiac sphincter. So this is the cardiac sphincter. Okay, and this is the pyloric sphincter, which will closest the bottom. You are able to understand?
Yes, ma'am.
Yes. Then about stomach, there are two curvature, lesser curvature and the greater curvature. Lesser curvature forms the right border of the stomach. So it extends from the cardiac opening to the pylorus. And next is greater curvature, that is little longer than the lesser curvature, and it will cover from the left of the cardiac orifice over the dome of the fundus along the left border of the stomach to the pylorus. And next is gastrosplenic omentum or ligament, that extends from the greater curvature to the spleen. And next is greater omentum, that extends from the greater curvature to the transverse colon. Peritoneum completely surrounds the stomach. Okay, so this is the omentum. Lesser omentum, greater curvature and lesser curvature.
Yes, ma'am.
So next is layers of peritoneum, which is attached to the stomach. That is lesser omentum and greater omentum. That's what I told you now. Then notch. There are two notches. One is the cardiac notch and another one is the angular notch. So angular notch you can see at the bend of the lesser curvature. Then next about the walls of the stomach. So how many layers are there in the wall? So there are three layers: serosa, muscular wall and mucus membrane. So serosa, it is the connective tissue layer which is continuous with the peritoneum. And next is muscular wall. Muscular wall contains longitudinal fibers, circular fibers and oblique fibers. Okay, and next is mucus membrane. Mucus membrane folded and forming some rugae. See here you can see the rugae. Did you see the rugae here?
Yes, ma'am.
So this folds will be flattened out when the stomach is distended. Okay.
Okay.
Then see, this is the rugae lining of the stomach. So rugae you can see in the interior or inner surface of the stomach, and this will be helping for break down the food when the stomach contracts. Then next about the relations, what all organs are related with the stomach. So anteriorly, what are the organs? Anteriorly, abdominal wall will be there, left costal margin will be there, left pleura and lung, diaphragm, left lobe of the liver. Then posterior relations. Posteriorly, lesser sac, diaphragm, spleen, left suprarenal gland, upper part of the left kidney, splenic artery, pancreas, transverse colon, transverse mesocolon. So these are the structures which is forming the bed of the stomach. So where the kidney lies, that is the bed of the stomach. That is very important. So next is the blood supply. What is the blood supply of the stomach? So basically, all branches of the celiac artery, apart from that the gastric artery, the gastroepiploic artery. So these are the blood supply. So from the picture you will get to know the gastric artery and other branches, left and right gastroepiploic. The next is veins of the stomach. So all the veins which drains into portal circulation. So left and right gastric vein directly poured into the portal vein, and right and left gastric vein, gastroepiploic, join the splenic vein. The right gastroepiploic epiploic vein joins with the superior mesenteric vein.